Hello, I'm Dr. Joe Singh here with Meridian Health Center, and I want to explain why it's important for us to take digital x-rays in our office. Digital x-rays are very important for us because there are times on the exam and history that we can't really see or determine what may be going on within the body. Yes, the examination and history and surface EMG gives us a lot of information, but there's things inside in your body that we can't feel, or an exam can't elicit a positive or negative response due to the lack of severity, where an x-ray can actually give us a clear picture of what's going on with the spine. So every single patient that will walk in our office that has any form of condition will get digital x-rays, because the digital x-rays will show us exactly where a misalignment may be, how long it has been there, can we fix them, how long is it going to take us to correct them. I'm going to show you an example of a patient who's had migraines for 35 years and has been seeing me for 2 months. We just finished his checkup and a re-x-ray to see how he was doing. And after 2 months of care, his headaches have reduced to, he's only had one, very slight one, since he has started care. For 35 years, they were telling him that his headaches are going to be there for the rest of his life, but no one checked his structural components up in the upper cervical region. And we're going to show you what that x-ray looks like and why it's important for us to take x-rays, and gives us an idea how to take care of the patient. So once we get our x-rays done and we get that information, then it allows us to give a complete treatment plan and protocol to help take care of any conditions. So when you look at this x-ray is a patient that we just did a re-eval on. We've had this patient in our office for 2 months. He's had migraines for 35 years on 3 different medications. And on average, he gets 3 headaches or 3 migraines a week. Some, the severity of them being a 3 to a 4, where there are times that it lays him in bed for a day or 2 before they go away. No one addressed any of the structural components of it. So this is one reason why we x-ray spines, because we know that your brain and your spinal cord controls every single function in your body. And for everything to go down from your brain through your nervous system or through your spinal cord, your nervous system has to go through these bones. And as we can see in this gentleman, one of the biggest areas of subluxation or misalignments is here in the base of his head. His skull and his atlas, or C1 and even C2, have so much compression happening down through here. This is where the brainstem is, cutting off circulation up into his brain, triggering migraines. So for 35 years, this gentleman has been suffering from headaches, taking a bunch of medication, managing them here and there. But after 2 months of adjustments, he's had no migraines since. We can also see a lot of damage down here in his lower neck. We're addressing that for other reasons. But for a migraine purpose, we can see this is the area we look at. On digital x-ray, on examination, we can actually feel the severity of this. We can feel the misalignment. We can see which way it's misaligned and how to address it. But x-ray will give us exactly what is going on in this region and how to address it more specifically to reduce either the condition or the symptoms that the patient is having. And in this case, was in his migraine headaches.